Michigan is among the top 13 states when it comes to prescribing the most painkillers. That's according to the Centers for Disease Control and Prevention. That practice is adding to problems with opioid abuse because some patients get addicted to the painkillers and then turn to a cheaper drug like heroin. Doctors in Michigan are writing so many prescriptions for opioids it boils down to about one per person in the state. As Fox 47's Susan Corey reports, Sparrow is trying to stop it at the source. So instead of prescribing painkillers, doctors are using alternative treatments, which they say can be even more effective than pills.
Dozens of painkillers are being prescribed to patients who may not need them.
Opioids are not the only option for pain.
So instead of turning to the prescription pad, Dr. Gundam Raj at Sparrow Hospital's Pain Management Center is finding other options.
Physical therapy can help with even acute pain patients if it is indicated. Psychological treatments, mostly chronic pain patients, they have psychological problems going along with chronic pain.
The treatment varies based on the patient, but Dr. Gundam Raj says he focuses on what causes the pain.
When you have pain, you're not relaxed, your body's tensed up, there's other mechanisms acting in your body that's making the pain worse. So
it's a practice the Ingham County Prescription Drug Task Force says more doctors should follow.
There have been some pain prescribing guidelines that have been used in the ERs and things like that, so that we can kind of start to get a handle on just prescribing habits in general and try to get at that as a way to address the issue.
That also involves teaching patients about pain and what's considered an okay amount.
There's a limit to which we can just completely knock out that pain versus making you relatively comfortable.
Something Dr. Gundam Raj goes over with his patients. But he says in some cases, like after major surgery, opioids are needed.
If the pain is severe, a short course of opioids may be indicated. But if you have to prescribe them longer, then you have to reassess the patient and see, what's really causing the pain.
Susan Corey, Fox 47 News.
Doctors at Sparrow are also looking at the number of pills they put in a prescription, especially if patients only need a couple of pills. They're making sure that that's all they can get. Another key to cutting down on prescription painkiller abuse is if your teen is being treated for a sport injury or pain, ask your doctor about alternative treatment and only use opioid painkillers as a last resort.